Suicide impacts the lives of people today, our family and friends, and our surrounding communities. It's a very sensitive topic, so assisted suicide is very controversial in our society today. According to the American Foundation for Suicide Prevention, suicide is the 10th leading cause of death in the United States. In 2017, nearly 50,000 Americans died by suicide. Again, in 2017, there were an estimated 1.14 million estimated suicidal attempts. In 2015, suicide and self-injury cost the United States $69 billion. On average, there's 129 suicides per day. And in 2017, firearms accounted for 50% of suicidal deaths. Some more facts regarding suicide can be found on the American Foundation for Suicide Prevention. Suicide is defined by the voluntary taking of one's life. Euthanasia, in Greek terms, is considered a good, easy death. There are several different meanings within that. Active euthanasia is ending one's life with a terminal illness with medical care. Passive euthanasia is withholding medical intervention without the patient's consent. And a physician's assisted suicide is helping a person kill oneself per medical technology. I'd like to share the timeline with you when assisted suicide began. In 1941 in Switzerland, a physician and non-physician began performing assisted suicides. In 1990, a Michigan doctor named Jack Kevorkian created a suicidal machine and assisted in nearly 100 deaths. If we skip over to 2017, in February, the DC Death with Dignity Act goes into effect, and implementation was brought in to June 2017. In 2018, in April, Hawaii becomes the 7th jurisdiction to enact an assisted dying law. Our Care, Our Choice Act will go into effect in 2019. And in May, the California End-of-Life Option Act is suspended for 3 weeks following a district court ruling. And on June 15th, an appellate court reinstates the law. Now, there is a connection between suicide and depression. Over 60% of people who die by suicide suffer from major depression, including alcoholics who are depressed. The figure rises to over 75%. Nearly 10% of Americans aged 18 and over, or 24 million people, suffer from depression in a given year. And about 15% of the population will suffer from clinical depression at some time during their lifetime. 30% of the clinically depressed patients attempt suicide, and half of them ultimately die by suicide. Many people assume or hypothesize that terminally ill patients request a form of suicide because they are in severe pain. However, evidence does not support this. Marlee L. Van Der Lee, around 2005, did a clinical study, terminally ill cancer patients in the Netherlands. Patients with clinical depression were 4.1 times more likely to make an explicit request for euthanasia. Now, in Oregon, the DWDA yearly assessments concluded that between 1997 and 2008, the most frequent end-of-life concerns for those who utilized the law were loss of autonomy, which is 95%, decreased ability to participate in activities that made life enjoyable were 92%, and loss of dignity was 92%. In 2008, only 5% cited pain as a major concern to assisted suicide. DWA and depression links. Of 58 participants with terminal illnesses that requested an aid in dying from a physician or contacted an aid in dying advocacy organization, 15 patients met the case's criteria for depression, 13 met it for anxiety, and of 18 patients who received a prescription for a lethal drug, 3 met the criteria for depression. So why does this matter? The DWDA, which is death with dignity, specifies that those with depression or psychological concerns such as depression or bipolar disease should be referred to for treatment. The problem is a lot of these people with depression and suicidal thoughts don't seek out the help that they need. So according to the data taken from the assessment of DWDA from 1999 to 2008, only 10.7% of patients were referred to psychiatric evaluation. And in 2007, none of the 46 patients who used physician-assisted suicide were referred to psychiatric care, while in 2008, 3.3% were in 2008. So what should we do about this? 90% of those who die by suicide have diagnosable psychiatric disorder at the time of their death. Not all of these people get the care that they need, like I was saying. Depression is one of the most treatable psychiatric illnesses. Between 80% and 90% of the people with depression respond positively to treatment, and almost all patients gain some relief from their symptoms. Depression has to be recognized and treated to encourage people to speak up. In order for our society to do better and to catch these signs of depression and suicidal thoughts early, is to recognize the symptoms of depression. There are changes in sleep pattern, appetite or weight, increased anxiety, fatigue, or loss of injury, feelings of hopelessness, worthlessness, and guilt, reoccurring thoughts of death or suicide. It's important that we take suicidal threats seriously. 50 to 75% of all people who commit suicide warn a family member or friend of their intentions. We have to be willing to listen to those who are thinking these thoughts. We have to seek professional help if it's affecting us personally. We have to be considerate to all we meet. We never know who may be suffering from depression or suicidal thoughts. In regards to assisted suicide, we need to spread the correct knowledge of assisted suicide and why people often resort to it, mainly because of depression, mental illness, and the fact that they just aren't getting the care that they need. It's important to encourage people to seek psychological evaluation and treatment at the end of life, especially if they are considering suicide. And lastly, it's important to contact the representative within the hospital to let them know where you stand on the issue. Be an activist for the right to life.